Hey guys, I hope you're doing well. Dr. Shook here. Today we're going to be learning something new. We're going to be talking about one of the ways that inflammation causes fatigue. And in particular, we're going to talk about how inflammation can actually affect your body's ability to produce cortisol, your stress hormone. And cortisol and the activation of the glands that make cortisol is really important to your energy production, your ability to have normal metabolism, weight loss, and it affects quite a few different things. So that's what we're going to talk about here in just a second. So I'm going to step out of the way for just a second so you guys can look at this, and I'll be right back. But in the meantime, if you would just, if you guys are joining me, just put where you're from in the comments, and if you have any particular questions as we go, don't hesitate to post those in there too, okay? So I'll be right back. So you guys take a look at this, and then I'm going to explain this to you and break it down, okay? Okay, so let's talk about how inflammation causes fatigue, guys. What we're going to do here is we're really going to look, I like to teach you guys how the body works, at least from a detailed enough perspective that you understand how some of the hormones are made and how they interact with the different glands of your body, and then how these hormones can be disrupted. Okay, so let's start here by looking at, in particular, what we're going to talk about is how inflammation affects the ability of your adrenal glands to make cortisol. Okay, so let me walk you through this first. So everything that's in black here, you've got the brain. Okay, so brain's here. You've got the pituitary gland, which is this stalk-like bulb here that comes off of the brain. And then we have the kidney, and on top of the kidneys are adrenal glands. And there's basically two parts. There's an outer and an inner part, and they make different types of hormones. Now, I've gone through this with some of you guys before. You may have seen it, but for those of you that haven't, the way that this works is you have a central structure in the brain called the hypothalamus. And the hypothalamus is consistently, it's always listening to the different hormone levels in the body, and it is kind of this common pathway where the nervous system, the endocrine system all meet, and the body uses the hypothalamus to change hormones based and uses the nervous system to influence the production of hormones. And so it's constantly listening and monitoring the levels in the body. So the hypothalamus is a regulator in a lot of ways. And what it does is, if your body needs cortisol, if it needs cortisol, and cortisol, you have to have cortisol to produce energy, guys. These glands also, when cortisol is made, your body also makes basically adrenaline. Now, if you think about adrenaline gets it helps you to produce energy, okay? Adrenaline energizes you. If someone's ever jumped out and scared you, and you felt that your heart rate jumped, right, and it puts you in that like fight or flight mode really quickly, that's because your adrenal glands pumped out cortisol and adrenaline very quickly. So if you don't have adrenaline, you're going to have very low energy, and you also won't be able to burn fat. There's a lot of different interactions here. But the way it works is the hypothalamus, if it detects that the cortisol is low, what it will do is it will produce CRH, which is a hormone that stimulates the pituitary gland here to make ACTH. Now ACTH, what it does is it stimulates the adrenal gland, and what it does is the ACTH will attach these little blue things here. The blue things that I drew right here on the gland, those are supposed to represent receptors. So the gland is what it does, it has these receptors where the hormone that's coming from the pituitary, the ACTH, can attach. Whenever the ACTH attaches to that receptor, it stimulates the gland to make cortisol, okay? Cortisol and adrenaline, right? So that's energizing. So this process is what we want to normally happen. We want the brain to be able to produce cortisol when it's needed so that we're energized, okay? So one of the ways that this can be disrupted, and one of the ways that a lot of your hormones are disrupted, including your thyroid hormone, because if you've seen any of my videos and you've listened to me, and I talk a lot about inflammation, it's probably the most common reason that I see people not feel well, even though they have normal thyroid labs. Their levels are normal, okay? Because inflammation disrupts the sensitivity of your body to your thyroid hormone and to a lot of hormones. So inflammation's huge. So inflammation, that's why you always have to look at on blood tests, C-reactive protein and homocysteine. Okay, those are the first labs that I look at when I'm evaluating someone's health. And I'm trying to figure out why do they feel the way they feel. And so, because I know if those are high, then what's going to happen is the inflammation will literally block and decrease the sensitivity of the receptor for the adrenal glands or for the thyroid or for the cells of your body, and you won't be able to use the hormones. So you can have normal amounts of the hormone but decreased ability to respond to them because of inflammation. So if you see that there's inflammation present, what do you need to do? We need to figure out what's causing the inflammation. Typically, food sensitivities, chronic infections, environmental chemicals. Primarily what we see. Okay? So that's where the investigation comes in. But this process of producing cortisol can be disrupted by inflammation. Now, so let's look over here. Some of the common ways that I see the production of cortisol and a lot of hormones being disrupted is due to gut infections. So this is supposed to be a large intestine and a small intestine. So just so you guys know. And these little red things are like, it's inflammation produced from a chronic infection. Now, when we talk about gut infections, guys, can you tell me what are some of the most common gut infections? Okay, and I want to tell you this. So if you guys can, in the comments, tell me what are the most common gut infections. I'm going to tell you that there's 3 general categories of gut infections. So can anyone tell me, and just take a guess. Take a guess. What are some of the 3 common gut infections that we're going to look for? And here's something while you guys are thinking about and putting in the comments, what are the 3 common gut infections? I also want you to tell me, let's see, the 3 common gut infections. Let's just start there. So just put in the comments, like, what are the 3 common gut infections? Okay? I'm going to give you one. Fungal infections. Okay? Oh, I know what I was going to tell you guys. If you can have GI tract infections and not have symptoms, we find people that, a lot of times when I'm doing diagnostic workups, I'm trying to help people figure out what's happening. Well, what we do is we look at blood tests first, and then the blood tests, the expanded blood tests, give us direction as to what advanced tests we might want to consider doing next. Okay? So one of the most common advanced tests that I'm going to do after a blood test, not always, but one of the most common, is going to be a comprehensive stool profile. Now, we've found, and we see it routinely, that people that do not have digestive symptoms, there's no bloating, there's no digestive problems, there's no excessive gas, they don't think they have a digestive problem at all, have asymptomatic, so no symptoms, but they have gut infections. Okay? So here are the 3 categories, guys. I hope you gave me some responses. Number 1 is going to be fungal, right? So like candida, yeast overgrowth. Okay? Number 1. That's a common gut infection that we find. What's the second most common gut infection, guys? Bacterial. Bacterial gut infections. So an overgrowth of bacteria in the gut. And what's the third? Parasitic. So like a parasite. Those are the most common like GI infections that we find when we're working up drivers of inflammation. Drivers of inflammation. So we've got to look at the gut. The gut's very, very common. Now, guys, you can have other types of infections. We're doing a lot more blood testing for pathogens, looking for bacteria, viruses that might be active, tick-borne pathogens, so different types of bacteria that can contribute to Lyme disease. There's also fungal, like mold, environmental molds as well. So we're doing a lot of blood tests in combination with this to work up these infections, and it's helping us a lot to get more to the root of the problem. But these infections, what they do is they produce an inflammatory environment, and this becomes systemic. So what happens is it's the infection's in the gut, but it actually promotes an increased level of inflammatory chemistry throughout the bloodstream. So that's everywhere. It circulates throughout the entire body. And what these inflammatory chemicals can do is they can decrease your sensitivity to your hormones. So again, here guys, if your adrenal glands need to be stimulated by ACTH, which is made by your pituitary gland, but the inflammation's blocking it, then the ACTH, you have it present, but it's not stimulating the gland, so you can't make cortisol or adrenaline, and therefore you have fatigue and you have decreased ability to mobilize fat for energy, and really it just creates a lot of potential problems. So some of you feel fatigued. A lot of people say, you know what, I've been diagnosed with adrenal fatigue. Guys, I say this a lot, and this is really important that you understand this. Adrenal problems are always secondary to something else. Let me say that again. Adrenal gland problems are always secondary to something else. There's always something else causing you to have problems with the adrenal glands. It's either, inflammation is very, very common, but you can see, and inflammation could be autoimmunity as well. So the autoimmune process produces a lot of, it typically raises inflammation in the form of proteins that are produced by the immune system called cytokines. Okay, cytokines. And these cytokines can block these receptors or decrease the sensitivity to the hormone. And that will cause poor expression or production of cortisol. The adrenal glands we almost always see them secondary to stressors, emotional stressors, physical stress. These things all stimulate a stress response and can deplete the gland of its the minerals needed to produce, the vitamins and minerals needed to produce some of the hormones. So you always see it secondary to something else. Blood sugar dysregulation, constantly taxing and putting stress on the glands is huge, is a big problem. Inflammation, obviously, emotional stressors and physical pain, they all stimulate a stress response, guys. So stress, whether it be physical pain, emotional stress, or chemical inflammation, these are all stressors that can drive the adrenal glands and deplete them of basically run them down, deplete them of their ability to produce hormones adequately. There's just a lot of things. I mean, you could have autoimmunity against the adrenal glands that are actually destroying the gland. There are a lot of things that can happen, but they're always secondary to something else. So when you see someone says, hey, you have adrenal fatigue, the question needs to be, why? So that maybe you need like a pathogen workup. Chronic infections will drive the adrenals. Like I said, chemical inflammation. Chronic infections produce inflammation. Chronic inflammation will stimulate the adrenal glands, and you can deplete them. So, I mean, to be very, to not be overly technical, right? It stresses the adrenal glands and causes them to produce more hormones. So these are things to keep in mind, guys, because if you're having problems with fatigue, you're having problems with energy production, it may not just be your thyroid. And keep this in mind. This inflammation that's produced here can be is very, very commonly affecting thyroid physiology as well, thyroid hormone physiology. Disrupting sensitivity to the cells, can suppress TSH production. Lots of problems. Guys, the more that you learn, the more that you should realize that everything is connected. Everything's connected. And if you start looking at one thing by itself, you've got to try to look at the entire picture, the entire health of the person, so that you can come up with the best interventions to help them as simply as possible. Because what you end up finding is that people have layers of problems. There's multiple things happening. So you've got to try to address, one thing at a time, or address multiple things at once with the simplest intervention. Okay, that's all I can really tell you is you've got to try to do one thing or a few things to have the greatest impact. And then as the person gets healthier and you start improving, then you can start focusing more on more individual things that you're trying to improve. But healing takes time, guys. These types of things, if you're not identifying gut infections, if you're not dampening the autoimmune process, and guys, what drives autoimmunity? What are the things that we see that drive autoimmunity? Okay? Food sensitivities, right? Partially digested food proteins that leak through a leaky gut into the bloodstream and trigger an immune response. Number one. Number two, infections, chronic infections. Bacterial, viral, fungal, parasitic infections. 3, environmental chemical reactivity. Immune reactivity to environmental chemicals. These are things that drive autoimmunity. So how do you improve an autoimmune condition? If you have Hashimoto's, if you have Graves', if you have ulcerative colitis, Crohn's disease, if you have any autoimmune diagnosis, what are some of the things that you should consider working up and looking into? Everything I just mentioned, guys. Are you reacting to food, partially digested food proteins? Are you reacting to gut chronic infections? Now, not necessarily just gut. Infections can be a lot of other places, So, do you have chronic infections? Do you have, are you reacting to environmental chemicals? BPA, bisphenol A. You guys may have seen one of my videos where I talked about sales receipts and how sales receipts, the slippery part on them is BPA. And it goes right through your skin. So, and BPA, we know, can mimic neurological tissues. Datis Karazian just recently, this year, published research where they showed that BPA can mimic myelin or neurological tissues, so nerves. So basically it can promote neurological autoimmunities to your nerve tissues. So guys, these are all things that are important. So the more that you understand, the more that you really know, the better your chances of getting better. Now, so in an ideal world, we are going to be able to say someone has problems, right? They have these infections, they have all these things going on. We can quantitatively test, measure, and help us to figure out what the web of problems contributing to your symptoms are. And then we can specifically take those things from the diet, use protocols to kill infections or dampen a viral expression. And we can really work very specifically on what's driving this process so that we can make progress faster, more specifically, right? Well, if we don't have that as an option, guys, then you just have to try to do the best that you can. And what's the best place to start? What is the very best place to start? If you have not changed diet, then making dietary changes is going to be the very first place that I'm going to suggest to most people where you should start, where you should begin. And so I like a lot of different types of diets. The autoimmune paleo diet tends to be a pretty good diet. It's not perfect for everyone by any means, but good for dampening autoimmunity, balancing blood sugar, and helping to improve gut function or gut dysfunction. Okay, tends to be a good diet. If you have, we have the 6-week Hashimoto's transformation program, guys. Right now, what we're doing, you can get that for $50. You can actually do a consultation with me and get the program, or you can get your thyroid antibodies checked and you can get that program. And we have a dietary program that works for autoimmunity. Now we call it the 6-week Hashimoto's transformation program, but there's a dietary framework in there. There's lifestyle recommendations. There are also guidance on supplementation, and we have a private Facebook support group just for people going through that program. So guys, that's also an option, but if you want to try something on your own, AIP is just fine. Autoimmune paleo is something you can research and do. And listen, this is really important as well. So if you make some changes, let's say you make changes to your diet, you're taking some supplementation. Guys, if you don't feel better, or if you're not great yet, if you do it for a few months and you're like, I just don't feel better, or if you do it for 2 weeks and you're like, I feel terrible on this diet, guys, you're probably not addressing the problem the mechanism that's causing your symptoms. So if you're changing diet and you don't feel well or you feel worse, then it may not be the dietary things that you're changing, they may not be the primary driver of your symptoms. So maybe you switch to an autoimmune paleo diet and you're eating a lot more protein, but what if your immune system is reacting to those proteins? What if you're eating more chicken and you actually react to chicken? Okay? That's a problem, right? I mean, you could be eating something that you react to. When we do food sensitivity testing, we routinely find that people are reacting to foods on the autoimmune paleo diet all the time. I'm going to tell you that I don't think there's a single time that I've ever done food sensitivity testing. Well, there have been, I think, a few times when people had no reactions. I hope we don't lose power. The lights are flickering here. There's been a time or two when people did not react to any foods, but most of the time when we do food sensitivity testing, people are reacting to things that are commonly approved on an autoimmune paleo diet. So just keep in mind that no diet is going to be perfect. You want to do the best that you can to be as specific as possible. Because guys, the more guessing that you do, the longer it's going to take. And, you can get better with doing trial and error. I've helped a lot of people doing a trial and error approach, starting with dietary changes, some supplementation based on what we think is going to be best for them. And they've improved, but there's a lot of people that will never get better that way because there are hidden things that we just don't know are occurring until we can see it in black and white and observe their immune response. Okay, so things like infections, chemical reactivity, you're just never going to know those things, and some of the foods you're never going to know either. But there's a lot of good you can do on your own, going through really good specific programs that are guided. You can really do better, guys. I hope this helps you better understand how inflammation can contribute to fatigue. It basically disrupts your adrenal gland's ability to produce cortisol, and if you can't produce cortisol, you're not producing adrenaline as well either. Inflammation has so many systemic effects. It's why when I'm looking at labs, it's the first thing I look at. C-reactive protein and homocysteine. I'm looking at those first because I want to know, is the inflammatory load high? If it is, why is it high? Because I know that it's going to have major impacts across your nervous system and your endocrine system, which is your hormonals, okay? It produces all of your hormones. So guys, I hope this has helped you guys out. If you need anything, don't hesitate to reach out to us. Remember, we do consultations and we can get your thyroid antibodies checked. But as always, I will try to continue teaching you guys everything that I possibly can, giving you everything free and guidance that I possibly can so that you can help yourself, become your own advocate, be better partners with your healthcare providers, and really just, take your health back. So I appreciate you guys a ton. Today, I don't have time to do Q&A with you guys because I do have an appointment here in just a few minutes. But I do appreciate you so much. Please do share these messages, guys. Think about how many people have no clue of this stuff. So please do share our message as much as you can. Help you get the word out about these types of problems so that people don't struggle needlessly, right? So that they can improve their health. You never know whose health you might impact or what difference it might make by sharing these types of messages with folks. But please do also give me some thumbs up and some hearts if you guys enjoy this kind of stuff. And please continue to ask us questions and be active in our communities. We really do appreciate you guys quite a bit. And if there's anything we can do, don't hesitate to reach out. But I hope you guys have a wonderful day, and I'll see you hopefully tomorrow. Hey guys, Dr. Shook, thank you for viewing our videos. I hope they help you out. If you want to, just subscribe to our channel somewhere here. You can watch a video that YouTube's actually selected for you, so hopefully it'll help you out. If you need any other information or resources, just look in the description. We've got links to our website, to our 9 lab test guidebook, and everything else that we do. I really appreciate you, and I hope you guys have a great